Hello, everybody. Sorry in advance. Obviously, I'm losing my voice, so we're gonna try to get through this. And um, yeah, let me know if there's any questions afterwards. So we're talking about endocrine systems and lymph today. Okay, ANP of the lymph system, not as widely known. Not as many people are aware of this. Like they know about their lymph nodes, but not necessarily the actual fluid, the lymph fluid as well. And so the lymph system is designed to help like maintain internal fluid balance as well as immune functions in the body. And I think we've talked in the past about passive diffusion out of the capillaries and out of the arteries into the tissues, and this is based on osmotic pressure and like concentrations and such of particles. And so that fluid will diffuse out into the tissues, but then it can't just stay there. Otherwise, we would always be, dehydrated and short on fluid. And so the lymph system works to kind of recollect that fluid. And as well as, fats, proteins, and such as well, because some of those things are too big to diffuse out, like the actual molecule size is too big to diffuse out in the capillaries. So the lymph nodes, spleen, thymus, and tonsils are are the components of the lymph system as well. And the lymph nodes contain lymphocytes, T cells, and B cells, which are responsible for our production of antibodies. These are the major lymph node chains in the head. Okay, don't worry so much about remembering them all, but just know that there's obviously lots of different chains there, and it can be predictable which lymph nodes would be swollen based on where like the infection is and such as well. So this is a better kind of drawing of the lymph system itself and these lymph vessels. And so they're kind of throughout the whole body in order to recollect those that fluid. Okay, and then as you can see, this spleen is in upper left quadrant as well. Okay. So thinking about things that can go wrong. Okay, so non-Hodgkin's lymphoma, it's this like group of malignancies that can develop in the lymphoreticulaire system. It can occur in childhood, but most of the time is more diagnosed around the age of 50. Okay. There's a whole bunch of different types of non-Hodgkin's lymphoma and different classifications, but it's more common in the abdomen, mediastinum, and in the neck as well. So this is, the staging of lymphomas. Okay. Like the higher the number, the worse it is. Okay. Obviously things are a lot more improved if it's better outcomes if it's just a single lymph node versus if it's, widespread. And that's versus, Hodgkin's lymphoma. And the difference is, the presence of these Reed-Sternberg cells. Don't worry too much about it. Just know that there is a difference. And Hodgkin's lymphoma is more common in childhood, and more common in Caucasians, higher socioeconomic groups, and males. And these are this is just a picture of common lymph nodes throughout the body that we check the most often. And so let me get my pen here. So like when people talk about breast cancer and that it's spread to their nodes, it's the axillary nodes here. Remember all those different like node chains that we saw a couple of slides ago, all running throughout here. And then inguinal nodes can also be, enlarged with STIs or other infections in the GU system. So that's versus leukemia. So leukemia is, way too many white blood cells, okay? And it's actually a cancer of like the bone marrow and the creation of those white blood cells, okay? And there's a whole bunch of different types, different treatments and prognoses. Can spread to other parts of the body, including lymph nodes, your liver and spleen, and occasionally gonads, kidneys, and the central nervous system as well. It all just kind of depends. And then thinking about vector-borne disease, so that's essentially meaning that it's in a host organism, and then that host organism spreads it to a healthy person, okay? So oftentimes this is avoidable by, avoiding the places where these things live, but so this can be, we're going to talk about ticks specifically, but it could also be like in one of the areas around where I live, the bats have rabies, and so, you want to obviously avoid, times of night where the bats are out. You also think about mosquitoes and West Nile virus and just the different diseases that these species can carry. So Lyme disease is the big one we're going to highlight. So it's a common tick-borne illness in the US, and it can be kind of hard to diagnose, but it has quite a lot of sequelae, and so it can affect multiple symptoms in the body. It's like early signs are like a red circular rash. That's, erythema migrans is what it's called. And that rash is usually accompanied by this like viral type illness, so it can be hard to figure out. And unfortunately, if it's untreated, it can lead to, serious arthritic and neurologic symptoms. And it gets harder to treat the longer it takes us to figure it out. So the big thing about this is knowing if there's ticks that carry Lyme disease in your location. Okay, so the like New England area is a big site for this because it's not all ticks, it's a certain type of tick, and so obviously really important whenever you're out kind of in the middle of nowhere to look for ticks when you come back, but especially in these areas as well. So Raynaud's disease, it's characterized by this vasospasm of the arteries. Most of the time it's in the hands, but it could also be in the feet, nose, and ears. And it's triggered by like cold temperatures and or like emotional trauma. And we do have to be like, okay, what is there something else that could be causing that vasospasm? And this is what it looks like. Their fingers turn white because the arteries are spasming, so there's not great circulation. Sometimes they even get a little bit of a purple tinge to them. So systemic lupus is a chronic autoimmune disorder that can affect a whole bunch of different parts of the body: musculoskeletal, skin, kidneys, cardiac, nervous system, and your body. So an autoimmune means that your body makes antibodies against itself, okay? And it's common in this exacerbation remission type pattern, and it happens more commonly in women in the childbearing years between the age of 20 and 45. Fibromyalgia is also this kind of group of symptoms that's chronic in nature, not inflammatory, and it's just this like widespread pain in multiple different places of the body, combined with sleep disturbances, fatigue, and often depression as well. And it occurs more often in women, predominantly between 30 and 50. And the struggle is there's no specific tests to diagnose fibromyalgia. It can be very difficult. There's some like trigger point tests that you can do to be like, okay, if you have pain out of like a certain number of these points, your likelihood of fibromyalgia goes up. But this is a diagnosis that got a lot of bad rap for a long time. It was kind of a provider's way of saying, oh, you're just a whiny woman. It's really not actually that bad. So we're trying to really shift the mindset when it comes to fibromyalgia, that these people are experiencing real pain, but it's hard to, it in general, like, people don't like, or providers don't like diagnoses that are hard to confirm, and unfortunately a few have ruined it for the masses of like taking advantage of these types of diagnoses. But in all reality, it is this kind of widespread pain that can make it really hard to function on a day-to-day life. But really, like, pain medicines aren't that helpful in treating this fibromyalgia. One of the best things actually is like consistent exercise. Chronic fatigue syndrome is defined as severe fatigue persisting 6 months or longer. This is also really hard because, I mean, the whole world is tired right now, like, or not really right now, but in general, like, a hallmark of our society is, people make jokes about the fact that, they're not sleeping, and they do all of these, like, a bunch of different things, and they're always so busy, and it's almost like a badge of honor to be busy nowadays. And so, but this is really like a next level of fatigue, like, like they literally cannot get out of bed and such. It's more common in women ages 30 to 50, and we don't really know much about it. And so in this setting, I typically have people go and see like a sleep doctor to see if there's anything specific we can do, or if we need to, try stimulants or something of the sort. Pancreatitis, so is an inflammatory process of the pancreas, because the enzymes within the pancreas get activated and it gets pretty inflamed. Okay, so 40% of cases are caused by blockage of the biliary tract and gallstone formation, which is more common to be the cause in women, versus in men it's more common for the cause to be alcohol abuse. And pancreatitis is very, very painful. People typically are admitted to the hospital solely for IV pain management. And then we'll talk a little bit about diabetes. It's about 8% of the population, or 29 million people, and about 86 million Americans have prediabetes, but most of them aren't aware that they do. And diabetes really increases your risk of mortality. It's nearly twice that of non-diabetics of the same age. So these are the normal blood glucose levels, irregardless of when somebody has eaten. If it's just a random sample, it should be less than 126. A couple hours after eating, somewhere between 100 and 140. And then this lab says, after fasting for 8 hours, it should be between 60 to 80. But that really depends on the lab that you're using. Mine is 60 to 99, so anything less than 100 is considered normal. But if we're really concerned, we really need to check an A1C. And A1C is the average blood sugar over 3 months, because it's measuring the amount of sugar that's attached to the outside of red blood cells. So red blood cells live for about 90 days in the bloodstream. And I think of it like the sour coating on the outside of like a sour gummy worm or something. So the more sugar that's in the bloodstream, the more that's going to attach excuse me, that's going to attach to that red blood cell. Okay, just like that sour coating. Type 1 diabetes used to be called juvenile diabetes or insulin dependent diabetes. We can't call it juvenile anymore because kids are getting, like kids as young as 8 or 9 are getting type 2 diabetes. So type 1 is loss of insulin production. Okay, so when the pancreas is no longer able to produce any insulin. Type 2 diabetes is by mark of insulin resistance, so your body still does make some insulin. So type 1 diabetes accounts for roughly 10% of total number of cases. Onset's usually less than 20 years of age. Versus, like I said, type 2, formerly called adult onset or non-insulin dependent. And this is, a combination of resistance as well as an overall decrease in insulin production. But it's important to note that, your body still does produce insulin. So that's why type 2 diabetics can often be maintained on only oral medications just to make their body use the insulin that it has better. Versus type 1 diabetics have to use insulin. Okay. And not always, but it's type 2 diabetes isn't always associated with obesity, but it can be. Going backwards a little bit, so in type 1 diabetes, there's a lot of different options now for people to use, like continuous insulin pumps that can mimic, your body's natural insulin release. So your body creates two different types of insulin. You have a long-acting insulin that's just kind of there all the time, okay? And then your body also secretes insulin like in short bursts, okay, like with meals and such. And so for the diabetic patient that requires insulin, we often try to mimic that. And one thing that's great about that, those continuous insulin pumps is it can really mimic your body's own natural insulin secretion. And so you can get a lot better and a lot tighter control of people's blood sugars with them. And it's wearable, it's in their body all the time, and then they often have a continuous glucose monitor as well. Okay. It's important to recognize, signs of hypoglycemia, which can be getting really sweaty, getting dizzy, lightheaded, even like altered mental states. I had a patient who was pulled over and actually charged with DUI, but she actually had type 1 diabetes and her blood sugar was very low. And so so she was acting and driving like a drunk person, but it was because her cognition was so affected because her blood sugar was too low. So these people always need to be very, very cautious and always have a source of glucose with them. Glucose tablets, Gatorade, anything like that is great in the short term to treat those hypoglycemic events in order to get them back up to normal. Often we use orange juice because it's just readily accessible, but the important thing is they also need to follow it afterwards with a source of protein to help maintain that blood sugar. Okay, so milk is a really easy one because it's obviously easy to drink and has a good amount of protein and fat in it as well. So for the diabetic athlete, it's super important that they measure their blood sugar and that they stay on top of that. Okay, and they always have to have their own insulin, and this is assuming that they're type 1. And then ideally their blood sugar would be 120 to 180 prior to activity because it's expected that their blood sugar will go down with activity. And then we also have to be pretty aggressive with treating normal athletic wounds like blisters and calluses because the fact that they're diabetic will make it harder for them to heal. So this is palpating. We're moving on to the thyroid gland. Okay, so you can see on the left the trachea, and then the thyroid wraps around it. I typically actually palpate people's thyroid from the back, and you have them swallow, and then you'll notice that Obviously, their esophagus moves with that, and it can be a little bit easier to palpate. Hyperthyroid is a hypermetabolic state, so thyroid is kind of involved in a little bit of everything, so your symptoms can be pretty widespread. Hyperthyroid can present as anxiety, palpitations, hair falling out, those kinds of things. Affects roughly 1 in 50 women and 1 in 500 men. Can also be called Graves' disease. Okay. Versus hypothyroidism is more prevalent in women, and that's a hypometabolic state. And so people have symptoms such as constipation, fatigue, weight gain, dry skin. Okay. And it increases with frequency with age. The most common cause is Hashimoto's thyroiditis, which is an autoimmune